Hi, I'm Parrish. I'm a healthcare consultant and clinical social worker, and I'm going to speak to you today about community-based participatory partnerships. This is one in a series of presentations addressing evidence-based programs. Well, community-based participatory partnerships are a little bit unique in the partnership arena, and that's because, first of all, they engage partners within the community. So other organizations or individuals that effectively are invested in either the process or the program or the outcome. The second thing that makes them a little bit unique is that there is an expectation of activism and equity within and among the partnership. And what that means is when you bring these individuals or organizations together from the community for the purpose of guiding or implementing or stewarding a particular program, you are automatically engaging them in an equitable fashion. So while you may have a lead organization that really does assumes a little bit more of the oversight role or the implementing role, your partners are very active in that process of, as I said, providing guidance or providing feedback on the program. And you really do want that. So that is, in a sense, the name, a community-based participatory partnership. So why do we have these, and why is this even important? Well, in the world of evidence-based programs, most evidence-based programs in the health and social service arena are really both predicated on the fact that they are for a particular community of individuals, what oftentimes we refer to as a target population. And you want to make sure that not only are there representatives of that particular community that are involved in the partnership, but that you have cast your net far and are engaging other community organizations or members that effectively have investment in the particular outcome. So we'll try to make this a little bit more concrete. Okay. So there's a program that's evidence-based that's called A Matter of Balance, and that is a falls prevention program predominantly focused on older adults who are at risk of falling. The program was developed by the Roybal Center at Boston University, and it's an 8-week course, roughly runs about 2 hours a week, and there are trained facilitators. So in other words, if you were to be one of the facilitators, you have to go and get trained. Now, let's say you're a community organization and you're thinking to yourself, I want to create this partnership to implement this A Matter of Balance, and you're looking around and saying, who might be good partners? Well, the first thing you want to look for are who in the community either interacts with older adults who fall, or takes care of them after they've fallen. And so right away, maybe your natural partners might be hospitals or healthcare practitioners. You might also think about some of the social service organizations, besides, let's say, for example, if you're representing one, that also either provide support for individuals who may be falling or caregivers or families. But another area of exploration you might think about is, who are the first responders when somebody has fallen? So you think about maybe fire departments, paramedics, ambulance companies, and so forth. So again, when you think about your community partners, just that initial selection, who should you select? You're looking for people or organizations that really have an investment in that. So once you get everybody together, let's say, and you invite them to be part of this process, where do you go from there? Well, with evidence-based programs, typically they're fairly prescriptive, and the reason for that, of course, is that they've been proven for validity, and they're testing what they say they're testing, and they've been reliable. They're able to do it in different environments, and there are proven outcomes that are associated with the program. So you may not be changing the actual construction of an evidence-based program, but you certainly are modifying it for your particular environment. So again, you're looking to bring people together, you would describe the program, and you would walk them through and engage them in that process. So a couple of things I've identified here on this flip chart. So when you get your partners together, that's your community partners in the center. The first thing you want to do in a first meeting, for example, to engage people is say, okay, we've got this community partnership now. What do we really want to do with respect to roles or responsibilities? Well, I would hold off on that if you were gathering your partners together. And the first thing I would suggest is walking them through the evidence-based program. So what really is the vision of the program? So up here is the vision. So what are the outcomes? Why was the program developed? Explaining that. Clarifying who the target population is. Who are you targeting and what are the reasons for that? Then providing some information about the activities that are associated with the program. In the case of A Matter of Balance, there are these specific 2-hour weekly meetings where they learn everything from setting goals to increasing levels of activity to maybe even making some environmental changes to ensure safety from falling. And then you want to talk about resources and staff. In your community-based partnerships, it's really important that there is, as I mentioned earlier, equity in terms of what each partner brings to the table. So while one partner, let's say a paramedics or an ambulance company, might help with funding the training and certifying facilitators for the program, another organization may help out with a meeting space or other resources associated with that. So clarifying roles and responsibilities really can make a very successful partnership. Another is making sure, if you look at the center of this, is that by really engaging everybody over a series of several meetings, you are effectively ensuring that there's sort of what we call mission alignment. In other words, that those partners are engaging for a good reason. They have an investment in this. And then you are able to develop some very specific roles and responsibilities. I suggest before an actual program is launched with your partnerships, you take some time, maybe schedule 2 or 3 meetings. I think documenting once you've identified what are the roles and responsibilities for each partner, that can be very helpful. And being very clear when you will be checking in with them and holding regular meetings. I think a feedback loop is essential. So collecting that data, in fact, they may be involved with either pre and post test development, some of the questions or the methods. So ensuring that engagement really ensures success for everybody. Before we conclude this presentation, I do want to talk about an area that sometimes gets overlooked, and that's when things go a little bit sideways. What are the reasons it goes sideways, or the reasons that the program goes sideways, and what can you do about it? So the first thing is, oftentimes in partnerships, people get a little bit bumped up against some role confusion and communication confusion. So one way to address that, or solution, is to make sure that you've articulated the roles and responsibilities. Never hurts to put things in writing, but you keep those pathways of communication open. Another area is project fatigue. Sometimes you engage partners and everybody signs on with great enthusiasm in the beginning, and then over time there's a little bit of burnout and fatigue that happens. Here again is a great opportunity to make sure that you're staying in touch with people and finding out if their interests are shifting, what you need to do about that. And finally, even in the best of intentions and well-laid plans, there are accidents and developments that happen. And so one way to prevent, for example, staff turnover is to have plans, kind of a backup plan or even some backup facilitators, and think through some of those issues. But I will tell you, I've worked with many partnerships. I'm currently involved with lots of them right now, and they are where all of the richness in interacting and working together to contribute to an outcome for a particular community is all about. It's really exciting, and it certainly takes its level of hard work, but it's absolutely doable. And I wish you all the best of luck. Thank you.